Hello, I'm David James. I'm a paediatric emergency medicine consultant in Southampton and the emergency care lead for Healthier Together. In this short video, we will discuss the important points of remote assessment for children with abdominal pain using the Healthier Together pathway. This can be found through the Healthier Together website shown on your screens. This can be found by searching Healthier Together in any commonly used search engine. Once on the homepage, please go to Professionals and GP Primary Care Staff. From here, you'll see Clinical Pathways. And once this opens within Clinical Pathways, you'll see Clinical Pathways Remote Assessment. It might be worthwhile, if you're doing a remote assessment clinic, having these open so you can go between them. Let's start with abdominal pain. As with all Healthier Together flowcharts, it's in a red, amber, green traffic light system and broken into a number of domains. Any patient with a red feature needs to be referred immediately to emergency care, possibly by 999. Any child without any red feature but with an amber feature needs a face-to-face review or possibly a video consultation. If this can't be met in a timely fashion in the current climate, these patients should be referred to the emergency department. Let's look at some of the factors in each of the domains, starting with behaviour. Here it's good to ask the family what the child is doing. Are they responding? If they're asleep, can they wake them? And if they do wake them, do they stay awake? Perhaps they are awake, but they're in really severe pain. If any of these features are present, please suggest that they go to ED or arrange them an ambulance. Perhaps they're not that poorly, but they're not themselves. They're not smiling, they're tired, or they're irritable. In those factors, please refer them on to primary care. Going down onto skin. Ask the family what their peripheries are like. Are they cold? Are they pale? Are they mottled? Or are they blue? In that case, again, please send them to the emergency department. Next, on to hydration. A little more tricky to assess remotely, but you can ask some relevant questions to the family around their tongue, their eyes, and their fontanelle if they're a baby. Urine output. If there's been no urine for 24 hours, they should come to hospital. For 12 hours, they can remain in primary care, but they should have a face-to-face or video consultation. Any child with abnormal or fast breathing in the context of abdominal pain should come to hospital. And finally, there's a series here of things that you could check off as you go through the consultation. Do they have a non-blanching rash? Are they describing swelling that sounds like edema? Are they yellow? Do they have dark green vomiting? Have they recently injured their abdomen? We always want to ask about testicular pain in boys. It's really important and have a very low threshold for referral. Also, blood in the stool, or of course young babies with a temperature greater than 38 should come to hospital. There are also a number of amber features that you'll see in front of you, which are features which suggest an underlying condition that may benefit from antibiotics, such as urinary symptoms, but also other softer signs like a longer fever, a baby between 3 and 6 months with a high temperature, abdominal distension, or pain not settling with analgesia. In any child in whom you have concerns that parents or family are struggling with this illness, have a low threshold for a face-to-face or video consultation. If you've made your assessment and not found any features that are amber or red, you can reassure the family, but it's very important that you send them an abdominal pain safety netting advice sheet. This can be hyperlinked from the pathway as you see here and takes you to the Healthier Together abdominal pain safety netting advice sheet. Again, you can see it's in red, amber, green. There's some more information at the bottom on how to look after the child. Just click on that box. Now, if you're wondering how you might get this to a family who you're assessing remotely, the best way to do this is with the SMS share function. By simply clicking on this green box, reassuring it that you're not a robot, popping the phone number in here and share, and they will get sent a hyperlink to their phone by text message that they can view in their own time. I hope that that's been useful for you, and please log back in to look at some other videos soon.